Happy Friday and welcome to My Truth, Your Truth, Someone's Truth. I'm Tammy Harlib, aka Reutman.
And I'm Christopher Blakesley.
AKA what?
AKA I'm here.
And like we're still sponsoring our own show, Christopher, and that's your line, man.
That's true. All right. So first of all, the best law firm in Las Vegas, LBC Law Group, doing personal injury, criminal offense, and business law. How about you?
How about me? No, I don't do law.
No, you don't?
No.
Thank goodness.
I mean, I got a lot of experience. I should just go and sit for the Nevada bar at this point. But Danius Dynamics, we're premier in group hypnotherapy and individual hypnotherapy, where we help you change from the inside out.
Awesome. Highly rated by me, by the way.
Exactly.
Yeah.
Exactly. And I don't even pay him. It's like amazing. Today, we just have an amazing opportunity to be here with Dr. Kannard, who has worked extensively with clients struggling with eating disorders, substance use, and general mental health concern levels at all levels of care, from outpatient to inpatient treatment. She earned her BA in psychology from Arizona State University, her MA in clinical mental health counseling from the University of Phoenix, and a doctorate of behavioral health from Arizona State University. Dr. Kannard's wealth of knowledge in the field of psychology, mental health, and integrated healthcare is exceptional. Her first job in the field was mental health at Remuda Ranch Center for Anorexia and Bulimia. I can't even read. During this time, she decided to become more immersed in eating disorder treatment and developed her clinical competency as a therapist. She has contributed towards developing intensive mental health treatment programs for youth as well as adults, and assisting mental health facilities and primary care facilities to transform into integrated healthcare facilities, recognizing the need for wraparound services and multidisciplinary services for individuals with acute treatment needs. She is a board-approved supervisor for the state of Nevada and enjoys guiding staff in their own professional development to become skilled and a confident therapist. Dr. Kannard's passion for working with individuals and families on her journey to overcome mental health concerns and eating disorders stems from her personal struggles with both as a youth. She is able to connect with Mariah clients and families, authentically helping them understand that while the road will be challenging, recovery is definitely possible and attainable. So, welcome to our show.
Thanks for having me.
You're so welcome. I mean, I am just very happy about you being here. I have worked with you over the last couple of years, and I have just seen you do amazing things with youth and adults, and it's like really an honor. And, you know, I do want to bring to the forefront that when we experience something our own, then we get the understanding of what it's like. And so we can, maybe we don't know exactly what it's like for that person, but we have a better idea, because you just can't learn these things in a book.
Absolutely. Yeah, you can get all the education, you can have all the letters behind your name, but I think when you have the personal experience, it just helps you to connect a little bit more and kind of guide people on their journeys.
That's amazing. That's amazing. And so how long have you been in Las Vegas?
I've been in Las Vegas for almost 4 years. I moved here in the beginning of 2020, right when the pandemic happened, which was a really weird time because everything just shut down.
Did you ever go down the strip when it was all shut down?
I did.
And it looked like a ghost town?
All there was police cars parked outside of the casinos, and it
Eerie.
was...
It felt like a zombie movie.
It did. It was just a ghost town.
Yeah.
So
you came here 4 years ago. I'm sorry I interrupted you.
Yeah, so I moved here about 4 years ago. I'm coming up on 4 years. And I moved from Phoenix, so it was like a lateral move, not much different, a little bit cooler.
Which is hilarious, by the way.
Yeah, but I
A
like
little
it
bit
better.
cooler, yeah.
I like it better.
Yeah.
So I think I'll stay.
Good, good. Well, we're happy to have you. And it sounds like you're doing amazing work along with Tammy.
Yeah, when I first moved out here, I didn't initially start with Mariah, which is where me and Tammy work at. But the universe kind of guided me in that direction. So had I not moved out here, I wouldn't be where I am now.
Yep. During the pandemic, we were like essential workers, and nobody was on the road, and you actually carried around papers in case you got kind of pulled over, which was kind of interesting because it's like desolate, and like you're like the only one there, and then you see some police officers, and you're wondering, are they going to pull you over? Well, wait a minute, I got this paper.
Right.
You know. So yeah. So tell me, there isn't just one type of eating disorder. What are the different eating disorders that there are?
There are a lot. So the main ones that I think people think of when they think of eating disorders are anorexia and bulimia, which are two of the common eating disorders. So anorexia being primarily a restricting presentation. And you also have subtypes within anorexia too, where it can be just primarily restriction, or they can have restricting plus binging and or purging along with it, but restricting still being the main presentation. Bulimia is our binge purge presentation, where there is no restriction. That typically happens in bulimia. There's binge eating disorder, which is more just the binging presentation. And then there's ARFID, which I think has become a lot more common and more talked about in the last few years. That has subtypes as well, where ARFID, it's not based around body image disturbance, which kind of makes it different from the other eating disorders. So that one can be like a lack of interest in eating. It can be fear of responses that the body might have. So if someone went through a choking experience, then they might have an aversion to eating, or it can be sensory based as well. So kind of around textures and smells. And then we also have our OSFED eating disorder, which is kind of when you have eating disorder symptomology that doesn't fit in one of the boxes.
Yeah.
But you know that there's still some eating disorder symptomology. That's when it would be an OSFED diagnosis or other specified.
Okay. I'm going to bring you back a little bit, because some of the people watching the show, they hear these words, bulimia,
Yes.
anorexia, office, and have no idea. I mean, they're just words, right? Someone
Yes.
makes up a word, we all buy into it, we all believe it. And so let me bring you back. When you say bulimia, what exactly does that mean? What are the behaviors that kind of go with that?
Yep. So with bulimia, there is body image disturbance. So that's going to be one of the symptoms that we're looking at with most eating disorders, is a disturbance to the way someone perceives their body image. Bulimia in particular, you see a cycle of binging behaviors followed by compensatory behaviors, which can be purging. It can be the use of laxatives.
Let's go back to purging.
Yes.
What does purging mean?
So I think people typically think of purging as self-induced vomiting.
Okay.
Which definitely is a type of purging. But there's a lot of behaviors that fall into purging as well. So it doesn't have to be just self-induced vomiting, or that may not even be the purging behavior that we're seeing. So that can be one of them in addition to others, or it could just be self-induced vomiting, or it may not even be present. So they might instead be using diuretics, laxatives, diet pills, things of that nature.
Okay. And does that also include not eating at all?
So when you look at the restricting behaviors, that's where we start to go more towards anorexia.
Okay.
Where with bulimia, you see a lot of the binging behaviors, where it's going to be eating large amounts of food in a short amount of time, followed by the compensating behaviors afterwards.
Amazing. I know in working with you guys, it's one of the most complex disorders because it seems to include almost everything. There's anxieties with it, there's depression, sometimes there's suicidality, you name it, it's there, PTSD. And one of the things that I've really noticed is a real need for solid control. And has that been your experience? Because that's just my observation. It doesn't mean it's the truth.
Yeah, I think it's definitely a big factor that you see. So when you think of the factors that can contribute to the development of an eating disorder, I typically think of predispositional factors. So if there's a genetic vulnerability to it, if it runs in the family, or the precipitating factors where it might be kind of like you said, alluding to something where it resulted in a loss of control. So an illness, a death, a trauma, sudden major life changes and stressors. And that's where we can start to see people shift towards eating disorder behaviors, which can give them that feeling of being in control because they're controlling
vomiting.
Vomiting or the
or
intake of their food. So when everything outside of us feels out of control, it can feel like we at least have control over this thing, which can be our food, and it can feel like our bodies. But eventually eating disorders kind of take the reins.
Yeah. When you say genetics, and everybody likes the word genetics, but how often do you see it as a learned pattern from a parent that actually demonstrates that behavior?
I think even if there's not a family member that has an eating disorder, I think we can usually see some sort of patterns or trends within the family systems. So it can be like a pattern of dieting or ways of conceptualizing body image, rituals and rules around food in the home, having to have certain dietary restrictions. So even though the intention might be for other purposes rather than an eating disorder purpose, when you have someone that is exposed to that environment and that's kind of creating those rules and norms for them, compounded with other things like stressors, trauma, then that can lead to the development of eating disorders in people.
And can I hop in real quickly just to kind of piggyback off that question about learned behavior? Obviously, a lot of our behaviors are patterned from our parents, but have you noticed any kind of uptick maybe by learned behaviors on TV or social media, or some of the things that are commonly raising our kids nowadays, right, on our phones?
I think society and social media has absolutely contributed to eating disorders and disordered eating, especially if you have any sort of social media platform. You go on there and the first thing you see is, someone with a quote unquote, ideal body, or putting forth a standard of what beauty looks like, or what it means to, have worth. So, and when that floods your social media, or that floods you from even just different societal areas, then one can look in themselves and say, like, well, I don't look like that. So does that mean that I'm not good enough, or that I'm inherently bad, or I have less worth and value because this person has millions of followers and they have this outpouring of, oh, wow, you look amazing. So it can really make someone question.
Hey, I'm guilty too. I mean, I'm on social media, not that much, but I certainly have those insecurities at times when I see somebody else's quote unquote perfect life, right? Perfect body, perfect bank account, perfect home. And the reality is we're watching their highlight reel, right? And it can be very dangerous. And have you, since you told me that, yes, of course, it is sort of patterned by social media, how common are these disorders?
So eating disorders in general, from kind of what research has shown, it affects about 9% of the population.
Wow.
So if you're in a room of 10 people, there's probably one person that either is struggling with an eating disorder, disordered eating, or they're struggling with some sense of body image.
Wow. And I've heard you mention this a couple times. What is the difference between eating disorder and disordered eating?
Yeah, so the main difference is going to be the intensity and the frequency that you see some of those symptoms pop up.
Okay.
So and I don't want to downplay disordered eating by any means, because I think it's kind of like a gateway into eating disorders. So when I say that they're less intense and less severe, I don't want to downplay the lethality of it either. But you might be seeing with someone with an eating disorder, they might have an extreme obsession over the amount of food that they intake and their calories. With someone with disordered eating, you might see someone who eats in response to stress, for example.
And is that something you might take into account if you're trying to diagnose somebody? You might see those pattern behaviors and realize it might be going down a certain path?
Especially if you're trying to be proactive with it, because I'm sure that Tammy would probably agree with me that we get a lot of people who come in and they've been struggling for a long time, and it can be really hard, and this isn't exclusive to eating disorders, but with any disorder, it's harder to treat it when it has progressed so far, because we're having to, we're dealing with just more acuity.
Right.
And we're dealing with patterns and thought processes that have been there for a long time, so it takes just as much time to undo some of that, whereas if we can catch things a little bit more proactively, and you see that in medical care with medicine and all of that, where the more proactively you can treat something, the better the outcomes are going to be.
That makes perfect sense.
Yeah.
And last question, I know you have a few on your mind, but last question, just because I'm curious personally, is there...
Because he probably has one undiagnosed.
Maybe that's why I'm asking so many questions.
He's got a little bit of power and control issues. If you haven't
Tammy,
really,
I'm in therapy right now. Can you please?
Yeah, I know. All right, I'll let you get treatment.
But is there a difference in percentage between genders or any of those kind of smaller groups?
Yes. So first of all, everyone is susceptible to developing an eating disorder. But yes, you do see it being more prevalent in females versus males. And also in the LGBTQ population, you see it more prevalent. And then it's also higher prevalency in the BIPOC community as well. And so when you're looking at kind of why it's more prevalent in some groups versus others, I think, in the BIPOC community, you're looking at access to care, how medical providers may treat individuals from that community, and the questions that they ask. Are they going to be asking the same screening questions they would ask someone who's Caucasian, for example, or from a different socioeconomic status? And then with the LGBTQ population, there's a lot of stereotypes and society standards that they are put, that there's pressure to achieve, and so you start to see some of that affect their ED rates as well.
That makes sense. Yeah, and I wasn't sure, but I thought there might be a little bit of a difference between those, so thank you for clearing that up.
Yeah, and I'm wondering, too, between boys and girls, right? I interned at juvenile detention for close to 3 years in the psych department, and at that point it was more boys, but that's just because the girls actually weren't getting caught. So I'm kind of wondering if it's the same, if boys just aren't being diagnosed, because you do see a lot of eating disorders in athletes, which is kind of interesting.
Yeah.
They have to be a certain type of weight, they have to have a certain type of body style, and so I'm wondering, is there really that widespread of a difference, or is it that the boys are not so diagnosed at this point,
Yeah, and I think even going back to what we were talking about with the societal pressures for body image, males are not excluded from that either. Their pressures look a little bit different from those that are put on to women, but they still have their own set of pressures that they experience of what my body should look like, and what it should look like if I'm expected to be masculine or machismo. And you're right, thinking about, is there this big of a discrepancy in males versus females, or kind of going back to, the BIPOC community, are medical providers actually asking the right questions to identify, is this an issue in the male population as much as they would in females?
Yeah, that's interesting. We run boys eating disorders groups. We don't do girls because we do them for you, so we'd rather not do that. But I am wondering if clinicians do need some more training on kind of what to look for in terms of that, so that more boys can actually get the help that I think they need. I think they're just not being diagnosed, and a parent will overlook that compared to a girl.
Right, or it might not be looked at with the same
urgency.
Yeah, as it would for a female who
Yeah.
you see this huge shift in their body image and their weight, versus if a male does it. And especially kind of separate from that, if someone goes from a larger body and then they start developing an eating disorder, but that leads them to be in what would be like a normal body size, then people don't look at that as often too, because they're like, oh, look, they were, quote unquote overweight, and now they're in a normal body and there's no reason for concern. But if you take someone who was 200 pounds and then they went down to 100 pounds, that's a huge difference.
Yeah. I'm wondering what normal really is. I mean, we have an idea and we're presented, as you said, about we should look like this, we should be like that. But why don't we just be ourselves and be happy with ourselves? Because as we're grasping for what someone else seems to have, we have no idea that their life could be even more miserable than our own. I want to kind of back you up on research. Christopher knows how I love research.
Yes, she does.
But I'm wondering if you are aware of any research that looks at an increase in eating disorders from before we actually had access to social media to now that we have all the access to it.
And I'm sure that there is, especially because just the field of mental health in general has, there's been so much of a development in the field from previously. So I have no doubt that there's specific research that's been done to kind of look at the prevalences.
Yeah.
So.
I mean, with mental health, it's a little different. First of all, everybody has mental health.
Yeah.
And a lot of it has been kind of brought back close to what is normal. And so, like, if someone passes away, we can't even grieve anymore without it being some type of disorder, which is really quite sad, in my opinion. But it is what it is. Yeah. I'd like to know, at what is the youngest age that you have seen eating disorders at?
Me personally, or in general, because I know
I'll
there's
take both.
Yeah,
so,
let's hear both.
Sure. Well, me personally, I think the youngest that I've worked with is 11.
Okay.
Which, you look at all the ages that can be affected by an eating disorder, and it doesn't discriminate. So I know that there are agencies and centers out there that treat even younger than 11.
Really?
I know at Mariah we've gotten calls on the admission lines for people who are seeking ED treatment for a 6-year-old.
Really?
And it's so hard to fathom a 6-year-old having the type of thoughts around body image and obsession around food that someone in their adolescence or adulthood would, because their lived experience is so much shorter. But I think it kind of goes back to what we were talking about with what are the different factors that are lending themselves to the development, because a 6-year-old doesn't just wake up one day and say, I need to lose weight.
Right. I was going to ask that exactly.
Right.
I appreciate you expounding on that, because I was curious if the ages of that diagnosis may be creeping slightly lower, as kids are kind of raised on YouTube a little bit or any other social media. But it sounds like, 6 years old is almost unfathomable, but it's happening.
Yeah. I can't even imagine thinking about that when I was 6 years
my
old.
gosh.
I was more concerned with who's going to give me cooties on the playground.
Yeah. Well, I mean, they're thinking of things much younger than I would ever thought about. Not just eating disorders,
right,
Yep.
right.
but
It's true.
you know,
Grown up fast.
lots and lots of things.
And while we're talking about children, because a big part of our show, we're looking to just kind of educate people, demystify some of these issues and problems and concerns. If I'm a parent and I have a 6-year-old,
You're going to
or an
be a
11-year-old,
parent this weekend.
That's right.
That's why when you
a
said you
sweet-
had a stomach ache, I thought you were having morning sickness.
Yeah. Shit, I'm getting a puppy. Having a puppy
Oh, how
tomorrow. Yeah.
fun.
Cute little long-haired dachshund. So
I love dogs.
I'm preparing. Yeah, I'm really excited about that. So I hope my dog doesn't develop any of these. But if I'm a parent of a real child, what are some of the red flags that I might want to look out for? That because we mentioned it can be a path.
Yes. So the first thing that I'm going to go into red flags, but I think it's really important for parents to not downplay when their spidey senses go up and they're like, this seems off. I can't tell you with the adolescents that come in with eating disorders how often the parents are like, I thought something seemed a little bit off, but I just, hoped that it would go away, or I hoped that my gut was wrong. So they're the experts on their children. I know they're not the parents are not the experts on eating disorders, but when there's a shift in your child, and that's where I think the red flags kind of come into play, is when we're starting to see those shifts from baseline functioning. So with just eating in general, I think when you start to see rituals and rules develop that are a little bit different, rigidity around food and eating, changes to their preferences where they might, say, well, I'm vegetarian now, or I'm going to just do clean eating. So you start to see shifts in dietary preferences, changes in their activity levels and their exercising habits, or the development of that starting. Whereas, like, if that wasn't a thing before, then it's a sudden new thing. The mental health component, I think, is really important too, because it's heavily intertwined with eating disorders. So if you see, some sudden shifts in mood with irritability, impulsivity, suicidality, self-harm, even just things like basic daily functioning, they have changes to their sleeping habits. They're less likely to take care of themselves with their basic daily hygiene.
So it's kind of a wide array.
It really is, yeah. So I think, when you're seeing just kind of a lot of these different, and a lot of it will kind of happen, together, where it might start off as, well, my kid doesn't want to eat meat right now. And then you may start seeing that they'll only eat at certain times, or they will only eat certain ingredients, or they're really secretive about eating. They start pulling away from enjoyable activities, so that they can, work on a new recipe. Their relationships are being impacted. So a lot of it kind of compounds really quickly.
That makes a lot of sense. And I want to hit on this really quickly, because you're the second guest we've had on who has, when asked about, what are some red flags that parents can look for, they often say, well, look within. If your spidey senses are going up in terms of your children, trust your gut, right? And that's so much of what our show is actually about, is going inward rather than outward, right? If your gut is telling you something's true about something that you love, somebody that you love, trust it, that we can trust ourselves, and we can develop that skill as well. And so I think that's super important, and I appreciate you mentioning that.
Yeah, because best case scenario, your gut is wrong, but at least you did your due diligence of kind of seeking out to see if there were any concerns. And then if there were, then it kind of goes back to that proactive standpoint too.
I love that.
Yeah.
Awesome.
How often do you find that parents are a little resistant to admit that their child has an eating disorder, maybe, feeling bad, like they had done something to contribute to it?
I see it a lot, and it shows up in different ways, where I think it can be denial that their child might have an eating disorder, which I think can come from a lot of different places, like a lack of knowledge about eating disorders.
Yeah.
So if you don't know what it is, it's hard to say, yeah, my kid has this. It can be rooted in guilt and shame of, like, did I cause my child to have an eating disorder, or I wish I had caught it sooner. It's easier to deny something and to push it away than to kind of admit it's there and to deal with it and to be, raw and vulnerable with it. And then they might be getting misinformation too. And that kind of goes back to what you were saying about just more training and education for, I think, the field in general, so that people know what to look out for from a proactive standpoint. Because, again, going back to a situation where someone goes from, being in a bigger body to what would be like a, quote, normal body, a healthcare provider might look at that and say, well, they're fine.
Right.
There's no medical concerns, like their BMI is fine, and we're looking at just these very stereotypical ways of determining health. And then internally, we have no idea that there's this obsession around body image and that sense of control that they're trying to seek.
Yeah. I'm wondering, when I was a school psychologist, there were fads like the cutting behavior, right? Where kids would start cutting, boys and girls, by the way, and they would do it because their friend had told them that this will help you feel better, even though they're like, it's painful. They don't say it's not painful, but they get a sense of relief afterwards. Do you ever see that the pattern develops because their friend is doing it, or even someone's friend's parent is doing it?
Yeah, well, I can say kind of from personal experience that, some of my own eating disorder as a youth developed from some of those conversations within my friend group, where it would be, focused around, oh, I'm only going to eat a certain amount, or, I ate too much, so I'm going to skip this meal. And then you start getting those ideas and those rules and rituals ingrained, and then you look at yourself and you're like, okay, well, like if they're doing this and they have a boyfriend and they're a popular kid, then maybe I should be doing it too.
Yeah.
So there is definitely that influence that people can have, that they can get from people around them.
Yeah. I don't know if you're willing, and you can definitely say no. I've been told no lots of times before. Can you go a little bit within yourself and kind of describe what it was like for you having an eating disorder? Like what it felt like, what thoughts went through your mind, how you maybe perceived other people were looking at you, and you can say no.
Yeah.
But I think it's important for people to understand what it's like.
Yeah. It's a really lonely place to be, because the eating disorder, eventually just kind of takes over, and it feels like it's a part of you. So it's very hard to open up and share what that experience is like when it feels so intertwined with your identity. And when it feels like people won't understand, especially. Because, people can come with good intentions and be like, well, just eat, or, why are you doing this? And all those questions can come from a place of I want to help, but it can be perceived as, oh, we have no idea what I'm going through, so why would I open up to you about it?
Sure.
So it can be really lonely. For me, there was a lot of anger tied to it, because it felt like at each progression of the eating disorder that, if it told me, get to this certain weight and I would get there, it didn't feel fulfilling. There was always this sense of emptiness, or, I need to continue to get smaller and smaller and smaller, or do more behaviors in order to achieve something that it felt like I didn't have.
Sure. And you're going to be a mommy very soon,
Yeah.
right?
Congratulations.
Thank you.
And hopefully your kids don't develop one, but if you were to bring yourself back to that time, how would you have liked your parents to handle it? How would you have liked them to approach you in regards to it?
I'm glad you asked that question, because my mom was actually the main person that kind of went with me through my eating disorder, because my parents are divorced and I lived with my mom most of the time. And when I actually first started with Mariah, I had led a training for the community on just eating disorder 101, and I had my mom pop in, and we had never really had a deep conversation about her experience of me having an eating disorder, and she was in tears the whole time, and I couldn't believe it, because it's like I was so focused on my own experience of the eating disorder that I never thought what my mom went through in guiding a child with an eating disorder. And I'm her only child, and she had no prior experience on how to navigate eating disorders, and just hearing how hard it was for her. She was like, I at one point went to the doctor and had them put me on an antidepressant. And I was like, well, I was on an antidepressant. Why were you on an antidepressant? And, she did all that she could with taking me to therapists and dietitians. And so she utilized everything that she could in order to help me. But she was like, I didn't know what I was doing. Like at that time, she felt like there was not really adequate parent resources. She was just going based off of what my pediatrician would recommend, or what my therapist or my dietitian would recommend. But beyond that, I think she felt probably as alone as I did within my own eating disorder.
Yeah.
So when I came to Mariah, and my first house I opened up was the adolescent female eating disorder house. That was kind of my focus, was how do I bridge the experience for parents as well? And, you know, obviously we have the kiddos that are getting treatment 24/7 at residential.
And they're very happy about it. And they're so willing to, like, just listen to what it's like for their parents.
Yeah.
Is that sarcasm? I think I sensed a
It's
little
a
bit
little
of that.
Yeah. And,
Because,
you know.
because it goes to what Julia's saying, is that they think that their parents don't understand.
Right.
And no matter how many times they say it, no matter what framework they put it in, they still feel very misunderstood.
Right.
So they don't, at that point, don't want to hear what the parent thinks. But
Yeah,
sorry,
and
didn't mean
to be
shut you
fair,
off,
the
but-
parents really may not understand.
Right.
So it's a really unique opportunity to bridge the parents with their child and to create that reunification for them and to get them on the same page. And I always told parents coming in, I'm like, you're the expert in your child, we're the expert in eating disorders, so we're going to kind of combine forces
Yeah.
so that we can get your whole family on the right track. Because yes, your kid's here for treatment, but really your whole family needs the support as well.
Definitely. And we did family groups,
Yeah.
and they did go very well, but you did see the dynamics in the household, and the dynamics between, you know, the parent and not just that child, but all the children, and how it affected siblings too, you know. So that is a component that I think, in my long history of mental health, the family doesn't always get addressed. It's usually, oh, just the child with the problem, or just the parent with the problem, but not the whole family as a whole. And I think addressing the whole family makes it more successful.
Yeah,
correct?
absolutely. Especially if that child's going back to their family after
Yes.
treatment, they have to know how to take on that piece that residential was holding to begin with.
Right, and start moving that into the
Yeah.
household.
Definitely.
What services are there in our community?
So in Las Vegas for eating disorders, there's not a lot. We treat eating disorders at Mariah, so we have an IOP and a PHP. There are some other outpatient services in Las Vegas that also work with eating disorders, either, you know, on a strictly outpatient level. There's some IOP and PHP programs. For the state, we don't really have anything intensive as far as, eating disorder residential or inpatient, which is a huge need.
Right.
So it's when you have someone that needs that level of service, then you're looking out of state. If you're not familiar with services out of state, then it's kind of like a waiting game of, you know, what can we find? Do they have beds available?
Yeah.
Do
Well,
they
not
feel
only
like
that, I'm so sorry to cut you off, but also imagine
He's
a
not
parent
really.
trying to send their kid off out of
it's
state,
terrifying.
right? I mean,
it's terrifying.
That might create even more.
Being in the same state with your child and being able to be, you know, closer to their treatment seems less scary than sending your child across the country
Right.
with people that you don't know. You haven't seen the facility. You don't know what their treatment is like.
Right.
And you're just thousands of miles away from your baby. That's so scary.
It's got to be terrifying already within a terrifying situation. And while we're talking about the inpatient and outpatient programs, what, if you can, describe some of the typical modalities or treatment programs outside of being inpatient, outpatient? What are some of the things that they do to help treat?
Yeah. So with eating disorders, it's definitely multidisciplinary. So you're looking at the feeding piece, where we're looking at getting them refed, or stabilizing the feeding. So oftentimes working with a dietitian. The clinical piece would be where the therapist comes in, and we do some of the evidence-based modalities are going to be dialectical behavioral therapy, so working on kind of that mindfulness piece, cognitive behavioral therapy, because there is the big cognitive and thoughts component that goes along with that. A lot of exposure work, especially at the residential level. It's like everything is an exposure, from being in a group setting, talking about all these things that pertain to eating disorders, to being at the dinner table and having that plate of food in front of you 6 times a day, 3 meals, 3 snacks. So
Wow.
you have guaranteed anxiety 6 times a day. And then being able to work them into doing that in the community while they're still in a residential setting, so that they can eventually do that without residential needs.
Wow.
There's psychiatry, so if there's a need for psychiatric medications, then you'll have your psychiatrist on board. And then there's also things to consider in the community too, like a dentist. So if someone struggles with purging behaviors, specifically self-induced vomiting, then you're probably going to see some effects to, their teeth and their mouth area. Hairdressers was one that, when I first heard about it, I was like, I don't know. But then you think about the medical implications of eating disorders. If someone starts having hair thinning or falling out, hairdresser might be a good source of saying, hey, I've kind of noticed these things. And there's other people in the community too that can be supports, like mentors, eating disorder coaches, people who can really work within the community setting to provide additional support outside of formal treatment.
Wow. So it's a very holistic
Hypnotherapy.
approach. And therapy.
Yeah,
You know,
and therapy.
hypnotherapy.
Yeah.
Yes.
Yeah.
We do
No question.
hypnotherapy. It's got to hit the subconscious where it's all the coping skill has to move from it.
It makes perfect sense.
Yeah.
And this has so much overlap for me in my head, at least. Do you work with substance abuse? I mean, is it sort of a similar treatment program at all? Is there any
There is
any
overlap. It's funny because I actually just did a training this morning about individuals with eating disorders and substance
Oh, wow.
use and the
Interesting.
experiential avoidance that they go through when they are struggling with those conditions.
Right.
And there's definitely a correlation between individuals with eating disorders and substance use, 100%. So I think the treatment modalities can look similar, in respect to the different conditions. You're going to have probably different modalities that you're going to use, but looking at things like CBT and DBT, the psychiatric medications component, there can be some overlap where those would be beneficial to treating both of the conditions.
Now, real quick, just for the people like myself that aren't fully educated,
Yeah.
CBT, is that cognitive behavioral therapy?
Yes,
And what
and
was the second one you mentioned?
Dialectical behavioral therapy.
Dialectical behavioral
Yeah.
therapy. Okay.
So there can be some overlap in it being beneficial to both conditions, but I don't want to say it's like that's the evidence base for both, because each person's needs are going to be different too. So you have to take into consideration different modalities and practices that might benefit that unique person too.
Makes a lot of sense.
So our show is all about taking fear out of things that people may come across in their day-to-day life. What are some of the tips that you could give parents on taking fears out of finding the right type of treatment, finding an inpatient treatment center? What kind of questions, what kind of things can kind of calm them down about addressing, what's the next step?
Yeah, I think the first step for a parent, just thinking back on my family's own experience with mine, seeking support from a pediatrician can be a really good starting point. If you're looking at, there's some things that I've noticed with my child's physical well-being that seem kind of different, and I have some concerns. So a pediatrician can actually help to kind of look at trends that we're noticing and maybe weight changes. They can look at lab levels. They can look at, the heart functioning, all things that can be impacted by eating disorders. Therapy can be a really good starting point of just getting hooked up with an outpatient therapist to, kind of assess for what's going on and to see if this is, an eating disorder concern, or if
Yeah.
it's not, then, I feel I'm one of those people who's very pro therapy. So I'm
Right.
like, it can't hurt to go to therapy. And then also I think linking up with support groups can be really helpful too. There are a ton of online resources for parents specifically for
Yeah.
eating disorders. So like the Alliance for Eating Disorders, Becky Henry does a lot with parent support specifically for eating disorders. There's an organization called Feast that works on psychoeducation, especially for the families. So I think getting hooked up with those resources as well can connect parents with other parents and professionals that
Yeah.
can provide support and guide them in the right direction.
That's amazing. How does a parent come to the conclusion of one treatment center if they have to inpatient their child, picking the right one for their child?
I feel like if a parent is able to tour a facility, that they absolutely should. I think it is better to see where your child is going, than just going off of word of mouth, or going based on someone's description or a website description where you're like, okay, well, I don't know what that looks like. I don't know where my child's going to be sleeping. I don't know what the different providers look like. So if you're able to take a tour of the facility, I feel like that's really helpful. And asking all of the questions, which I feel like sometimes parents feel like they can't ask questions, but whenever I talk to parents, I actually welcome the questions because I want them to feel like we're a good fit for them as much as they're a fit for our program.
That's amazing.
Yeah, so first of all, I have to say you've been super open and honest with everything, and I can see why you would be a wonderful therapist. And so I super appreciate you not only being that way, but bringing that into our podcast. And I have to ask this because I am just curious.
Yeah.
Do you have any difficulty leaving some of your work at work versus bringing it home, especially in light of becoming a mother very soon? Do you have any issues doing that, or are you pretty well able to separate the two?
I feel like over time that's gotten a lot easier. As a newer therapist, I really struggled with it. And there are certain situations that'll happen with clients where I will bring that home just because it, was a really acute situation, or, it was something that maybe I relate to with personal experience. And we grow a connection with these kids too. So sometimes it's really hard to not think about it and to have that separation because we've identified so many needs and we want them to be well. And so we sometimes sit up thinking, okay, well, what are we going to do tomorrow to try and get them on a better trajectory? So I think it just takes practice. And that's why I really appreciate multidisciplinary teams too, because I'm not going to be working 7 days a week, 24/7, but I feel better knowing that I have a very competent team that is there when I'm not, so that way the kids are in good hands.
They're taking the baton from you when you're not there, and you trust that their work is going to be, it's going to be helping the child. Right?
Definitely.
And when you mentioned that just takes practice, but is it maturing? Is it actual, therapy yourself, or how are you able to kind of put things in their correct spot so that you can best treat the kids?
I think as far as that work and home life separation for me, I think self-care has been a really big thing, because otherwise I would go home and I would just think about all the things that happened during the day, and that would consume everything until I went to bed. So I'd be like word vomiting to my husband about everything that had happened with every single client, and I'm like, okay, now tell me what to do. So I think it's, being able to have a good self-care practice so you
can I specify what kind of self-care? Are you talking walks, meditation?
For me, I'm a dog person, so getting really wrapped up with my dogs was helpful.
Awesome. What kind of dogs?
I have 2 German Shepherds and a lab.
Oh, awesome.
Yeah, so reading is something I'm really big on, and gardening. I have my own garden, so being able to just be barefoot in my garden is really helpful. Yep. So connecting with things that really bring me passion. Feeling confident about my work too, and knowing that I did everything that I could while I was there, and that they're going to be there tomorrow as well, especially at residential, or even if they come in for a day program, knowing that we can pick up tomorrow and continue the work, even though we may have done really good work, and it's not done yet. The work is never done. Right. Complacency is the worst with mental health and eating disorders, so there's always work to be done. And I think for me, what was also helpful was finding the balance between processing what I experienced at work, but with boundaries. So I wasn't word vomiting to my husband, but I wasn't just bottling it up either, where I felt like this, nervous wreck or ball of anxiety either.
Yeah, I love that answer. And real quick, I'm going to pass it to Tammy. But one of the things I loved about the answer is so many of the things that you said that you do for self-care are so within reach, right? It's something you can read on your couch, you can garden in your backyard, right? We're not having to go on a vacation,
Yeah.
right, to do self-care. It is within our reach, and we can all do it on a daily basis. And I think it's important for people listening, whether they're a therapist or a parent or attorney or whatever, that self-care is vital, and you can do it on a daily basis without leaving town.
Yeah.
I think it's important.
Exactly. And I mean, being a clinician myself, it's good when you have your own work done instead of using clients. And I hate to say that, but it does happen.
Yeah.
Where you're using, your clients as reflective tools to move yourself forward. The other big thing, which I learned a long time ago as a school psychologist, is that the people that I work with, their success and failures are not mine. So I can't take credit for when they succeed, but I can be happy with them. And when they don't meet their goal, I'm there to kind of help them move up. I mean, that's like one of the most powerful things I
Yeah.
ever reminded myself, or, about leaving stuff from work to home. So,
Absolutely.
yeah. And I just want to thank you so much. I mean, I am just so grateful that you said yes.
Yeah.
I couldn't have thought of a better person to have on here to talk about this issue. I know your passion. I really know your passion. And I know that you do amazing work, and that with Mariah, and you have done tremendous work with those kids and the adults.
Thank
So
you.
let
Thank
me
you.
let me echo that real quick. Super appreciate you, Dr. Kannard. The work you're doing is incredible. I can see the passion, as Tammy mentioned, and the vulnerability. I'm sure those kids are very lucky to have you, and I can just see it. So kudos for that, truly,
Thank
genuinely.
you. Thanks.
Is there anything that you want to kind of not necessarily plug, but maybe give resources out to parents, or websites, podcasts, anything that you think might help that you want to put out there?
Yeah, I think some of the parent resources I mentioned earlier, so FEAST, FEAST, the Alliance for Eating Disorders, Becky Henry, we worked with her when we had the adolescent residential eating disorder house. And so she does still a lot of work in the community. She's on Facebook. She has a ton of personal experience, which I think she brings into her professional practice. As I mentioned, Mariah, we do eating disorder treatment at the PHP and IOP levels of care and outpatient. And then Tammy has been amazing in just working with our eating disorder population as well. So I feel like I have to plug Tammy also.
Thank you. I appreciate that. And if parents wanted to reach out to Mariah, how would they do that?
So they can go on our website, mariahbehavioralhealth.com. And that website also has our admission number. And our admissions team is fantastic. So even if parents are kind of on the fence, they're like, I don't know if my child needs to come here, but I have concerns. They'll just hear them out, potentially just do an over-the-phone assessment to kind of see what the concerns are.
Yeah.
And then they'll speak with the child as well if they feel like, we may move forward with looking into services. And our clinical team of clinical directors, myself being in there, we look over every single assessment to make sure that, one, do they need to come to us?
Yeah.
And two, what level of care is going to be the best? Because we want them to be in the right place and get the right level of help. So if not with us, then we'll connect them with community resources. But I do appreciate how much we offer in-house, where if we can do everything that we can in-house without having to piece it together in the community.
Yeah.
We do try to do that. It's just, I think it's easier for families to have everything in one place.
Agree.
But if we're not the right fit, we're not just going to be like, good luck. We'll help you find what might be a better fit too.
That's amazing. But they don't have groups for boys. But Danny's Dynamics does, in fact, have a boys group for eating disorders. So if anybody's interested in that, they can get our information at
They'll see it
dannysdynamics.com.
at the end of the show. Yeah, we'll put it up
I
there.
just said it.
There we go. Well, she said it. They'll hear it twice. I'm plugging you twice. And I think we only have a couple minutes left. Let's see, about 5 minutes left. And usually we have Tammy sort of lead a breathing exercise or a meditation. Do you have just a couple minutes before the end of the show? And we'll kind of turn it over to her. She'll demonstrate how amazing Danny's Dynamics is.
Yeah, thank you, Christopher.
See?
That's the
Plugged you
nicest
3
thing you ever
times.
said to me. Like, I'll have to write you a check when we leave. Since we are talking about eating disorders and the fact that there is a big control issue that kind of goes on with that, the breathing technique that I'd like to do today is to bring ourselves back into control. And one of the, best ways to do that is more like a ratio type breathing. So what I'd like everybody to do, unless you're driving, because I've tried this driving before, and I mean, I've hit walls and yeah, but if you're not driving, then I invite you to go ahead and close your eyes and focus on a place behind your closed eyes. And let's try to move the thinking away, even if it's just for 1 second. And we're only going to use the nose, so the breath is going to be in and out of the nose. And what I'd like you to do is start taking a breath in through the nose to the count of 4, and out through the nose to the count of 8. And go ahead and slow each breath down. And let's do about 6 of them. Just slow it down. Be in the moment. This is really the only moment that we really get. The past is gone. It only comes to the now if we bring it here. The future, we don't know what it brings. The anxiety of it only comes to the now if we want to pull it back here. So if you could just give yourself one moment of true inner peace, to feel the space behind your closed eyes, to be aware of what taking control of your breathing does. It relaxes you, but also if you're somebody that has panic, taking control of your breathing can bring the panic way down very quickly because you get that sense of control. The moment of silence. And when you're done, just open your eyes. And just take inventory, like from when you started to now, how does the mind feel? How do the thoughts feel? How does the body feel? How does the energy around you feel? Christopher, I'll ask you if I have to.
Of course.
How'd you do?
I kind of wish I had done it before the show, right? It puts me in such a peaceful state of mind. And whenever you gave that prompt of be in this moment, because it's all we have, I think it really brings me to a present, mindful state. And I just feel a little bit more myself and peaceful. And again, like we mentioned about self-care, something you can do on your couch, first thing you wake up, right before you go to bed. And it's such an accessible thing and so quick. So thank you.
Yeah, definitely. And the other thing is you don't need to take that many of them. Even if you took one, you're still moving yourself away from the emotion of the minute. And you don't even have to close your eyes. Nobody needs to know in the room that you're doing this. Because believe me, nobody's watching your abdomen, seeing if it's going up and down, How'd you do?
Good. I actually had the same thought. I was like, I wish I had done a breathing technique before I came in. So that's funny. But I feel, I don't know, a little bit lighter, I suppose. I feel like things around me just feel a little bit lighter. And my body feels just more at ease.
Yeah, I mean, it's amazing what just something so tiny can change a moment to be a whole lot more peaceful. And since we're here, life should really be peaceful. We don't have to make it so hard for ourselves. We really don't.
Absolutely, and that's our message to all of our listeners. And again, thank you so much, Dr. Kannard.
Yes.
It was awesome. And thank all of you for listening. Thank you, Tammy. This episode, again, brought to you by LBC Law Group and
Danius Dynamics. Make it a wonderful weekend or don't. That's really up to you.
Thank you so much. We'll see you next time.